I invited Mayor Williams to bring anybody he wants. I even invited George Scott, because I really like George Scott. I don't know him very well, but I have a lot of respect for him, and because of his community service. And he even stood up in a meeting before they sold him this building and told them, I have a recording of it from WVRC, that he told them the old building was too old, it wasn't suited for family health care purposes, and they just ignored him and went ahead with it anyway. So anyway, I sent a letter to Mayor Williams. I invited him and anybody he wanted to bring to meet with me and the board of directors, and let's solve this problem. The problem can be solved in one afternoon by simply giving us 60 feet off the empty lot across the street. Easy. I mean, how easier could it be? The city has made a fortune off of Walmart. Why not just include that in the cost of bringing Walmart to town? And they owe it to family health care. They absolutely stabbed family health care in the back. They gave them 20 feet of grass in their front yard. When that building was bought originally, you could not walk from the front door of Walmart down the steps. Who ever heard of steps up a medical building? I mean, that's just another thing over there that has to be addressed. You could not walk from the front door of family health care to the sidewalk without walking across 20 feet of city property. It's the most ridiculous thing I have ever seen in my entire life. So I've been pushing the board to fix it. Now, I invited Mayor Williams to meet with me and the board, sit down, talk about it, work out a reasonable solution, either a lease or deed or something, so that our patients would have really, really good parking forever. Didn't happen. Ignored me. Totally ignored me. So I started with the board. I started with creditors. Let's get this solved. Well, I sent a Freedom of Information Act because I discovered that Martha Cooper had actually been on the board of family health care, had voted for this thing, but she actually signed the deed back to family health care from the Spencer Economic Development Authority as the secretary. Blatant conflict of interest. I called Tom's hand on it. He said he didn't remember. So anyway, sent a Freedom of Information Act to Mark Whitley. He ignored it. The mayor got all upset about it, jumped on Margie Starcher, as she's told me, sitting in my office. Tom Whittier, Margie Starcher, and Dr. Christensen came to my office, and they jumped on me because I upset the mayor. I mean, come on, people. You know, this is the way business is done. So anyway, long story short, and I'm about finished here, about out of time. So anyway, Tom Whittier, on his way out of town, he comes by my office, and he says, you know, the mayor says if you'll resign or you'll retire, he'll fix the parking problem. I said, no, Tom, that doesn't work for me. So anyway, it was no surprise that I was going to be fired after that, because I'm assuming that the mayor just told the board, if you fire Larry, then I'll fix the parking problem. But the parking problem is not what the problem is. The problem is this cancerous relationship between the Board of Family Health Care and the city. This is about the future of family health care. We got a wonderful staff over there. People have gone so far and above what they would normally do. Sherry Bonnet going from billing supervisor, billing clerk to IT administrator. Amy Landis having 2 kids, getting a 4-year college degree, and now going on to be a family mediation counselor. There's stories like this on and on and on and on about personal victory and personal expansion, because we have a wonderful crew, wonderful crew at Family Healthcare. And to spite me, they fired me, and I'm the one that fixed it. I went to Washington and sat across the desk from Jack Egan and convinced him to leave Family Healthcare open in 2004 when he had decided to do it. But there's another gut level to this. You know, I've spent 8 years as an artillery officer in the United States Army. And my son has done tours in Iraq and Afghanistan as a Black Hawk Squadron commander. I know John sitting here with me is a veteran. Having a mayor here in town that acts the way he does to actually trample on democracy and our American way of life is just gut level offensive. This doesn't have anything to do with family health care. So this is why. This is about the future of family health care. If this cancerous relationship does not stop, family health care has no chance of survival, and it's important to this community. It's important to the 62 people we employ, or they employ over there. It's important to the 7,500 patients. It's important because family health care puts $2.5 million into this economy. So why? So I think this is a wake-up call. I had to get fired. I had to get fired because I had to tell this story with credibility. I did an interview yesterday with Metro News, and I'll do an interview anywhere I can to tell this story of how a sordid, screwed up political agenda here for the city of Spencer instead of building a health care center, has resulted in what you see today. I really thank you very much, and I really appreciate Mr. Koenig and WVRC for allowing me this opportunity, and there may be more. This is a wake-up call, folks. This family health care belongs to you, and this community does not belong to the mayor, does not belong to Tom Weir, and it does not belong to the board of directors. Thank you very much.
And for your legal ID, 1047 FM WVRC. Good morning.